Understanding malaria, where to begin? Let's start with the basics. What exactly is malaria? Well, malaria is a disease that is caused by Plasmodium species. It is transmitted through a bite of a mosquito. The Plasmodium species that cause malaria are Falciparum vivax ovale, malariae, and knowlesii. Identifying malaria, symptoms to look out for. When it comes to malaria, the first symptoms are typically general and similar to those of the flu. Fever is the most common indication. Prodromal symptoms such as malaise, anorexia, lassitude, dizziness, and a desire to stretch limbs and yawn may occur up to 2 days before the onset of fever. Other symptoms include headache, backache in the lumbar and sacroiliac region, myalgias, nausea, vomiting, and chills. Plasmodium falciparum causes the most severe form of malaria and can manifest as uncomplicated malaria when the parasitic load is below 5%. However, when the parasitic load exceeds 5%, complications are likely to occur, leading to complicated malaria. Complications from severe malaria are often found in individuals with falciparum malaria and no immunity. These complications can affect the central nervous system, cerebral malaria, respiratory system, and the renal system. According to the Global Technical Strategy for Malaria 2016-2030, despite its preventable and treatable nature, malaria continues to have a profound impact on the health and livelihoods of individuals worldwide. The latest available data shows that in 2013, approximately 3.2 billion people were at risk of the disease in 97 countries, territories, and areas. According to the CDC, malaria claimed the lives of around 627,000 individuals in 2020, with the majority being young children in sub-Saharan Africa. Malaria is most commonly found in impoverished tropical and subtropical regions around the world. In many of the affected countries, it is the primary cause of sickness and fatalities. Young children who have not yet developed immunity to malaria and pregnant women whose immunity is weakened by pregnancy are particularly vulnerable. The WHO Director General believes that eliminating malaria would be a significant achievement for public health, as new tools and methods are now available. Such efforts could save lives and provide economic benefits, particularly for vulnerable communities where 61% of malaria deaths occur among children under 5 years old. Global Technical Strategy for Malaria 2016-2030. An overview. In May 2015, the World Health Assembly approved the Global Technical Strategy for Malaria 2016-2030. This framework is designed to aid countries in their fight against malaria by providing a comprehensive approach to expedite progress towards eradicating the disease. The aim is to reduce global incidence and mortality rates by at least 90% by 2030. The Global Technical Strategy rests on 3 pillars. Pillar 1. Making sure malaria prevention, diagnosis, and treatment are accessible as part of universal health coverage. Unpacking Pillar 1 effective interventions, recommended by WHO to reduce mortality and morbidity rates. Vector control, maximizing the effectiveness of vector control strategies with local epidemiological and entomological data. The ability of vectors to spread diseases and their susceptibility to control measures differ depending on the mosquito species. Local environmental factors can also have an impact on the efficacy of these measures. Interventions for vector control include the following: indoor residual spraying and long-lasting insecticidal nets, chemoprevention, diagnostic testing and treatment. Now let's focus our attention on Pillar 2. Pillar 2 focuses on speeding up efforts towards the eradication of malaria and achieving a malaria-free status. There is an urgent appeal to countries to contain the spread of new infections. It is crucial for countries to intensify their endeavors to contain the spread of new infections in specific localities, particularly in areas where transmission rates are low. So how do countries achieve the malaria elimination goal? Well, the use of medication to decrease infectious reservoirs may be necessary for eradication in certain cases. Exploring Pillar 3, transforming malaria surveillance into a critical intervention. The key role of malaria surveillance in program planning and implementation. To expedite progress, malaria surveillance plays a vital role in program development and implementation, creating efficient health management information systems in countries affected by malaria. In countries where malaria is prevalent or at risk of resurgence, having a comprehensive health management system is crucial. The benefits of implementing appropriate surveillance systems. Implementing appropriate surveillance systems can have a significant impact on addressing the needs of affected communities, identifying gaps in program coverage, detecting outbreaks, and evaluating the effectiveness of interventions. Important to note, implement surveillance at all levels of transmission and respond accordingly. It's crucial to establish surveillance at every level of transmission to ensure that appropriate measures are taken. Response strategies should be implemented at the relevant units of operation, such as districts or communities, to prevent further transmission. Thank you for tuning in. I hope you found this topic both engaging and informative. Don't forget to show your support by liking and subscribing to our channel.